இது பேசுங்க. இதுதான் மேடம். இது ஏற்கனவே பண்ணினது சார், பண்ணிதான் இருக்கு. இல்ல ஏற்கனவே அனுப்பியாச்சு மேடம். இல்ல ரெண்டாவது தடவை நான் பண்ண அதுக்கு அப்படியே பண்ணிக்கலாம்.
இது பண்ணி டவுன்லோட் பண்ணிட்டு ஸ்டேஜ் இதுல ஸ்டார்ட் பண்ணிக்கலாம். இந்த டவுன்லோட் பண்ணுங்க. எல்லாமே டவுன்லோட் ஆப்ஷன் இங்க வரும். இதை தள்ளி விட்டீங்கன்னா இங்க இருக்க டவுன்லோட் ஆப்ஷன் இதை கிளிக் ரைட். அப்படியே அதிலே கிளிக் பண்ணி அதை கிளிக் பண்ணி ஸ்லைட் ஷேர்
போய் தான் நீங்க பண்ணணும்.
இப்போ அந்த இதை வந்து நான் இல்லை இதில் நமக்கு மைக் வரல, அதனால இதை நம்ம மீட்டிங் இப்போதைக்கு
போட்டலாமா சார்? கரெக்டா பேசுங்க. ஓகே சார். இப்படி பேசணும், அப்பதான் அவங்களுக்கு பேசணும். மைக்ல பொறுத்து
Good morning, everyone. I am Dr. Soumya. I'm from Satyasai Medical College. Today, my topic is rheumatic heart disease. There's a 12-year-old adolescent child named Bhavani who is presenting from Tirupuru, whose informant is mother and reliability is good. Presented with complaining of involuntary movement of left arm, forearm, hand, left leg, and foot since 4 weeks, fever since 4 days, and cough and coryza since 1 day. Child was apparently asymptomatic. There's a history of hospital admission 3 months ago for the pain involving in the left hip joint associated with difficulty in walking.
What I do in my classes, I will ask my PDs to take important. I will ask somebody to summarize. So like that, I will ask somebody to summarize. Please note down what are all the positive points, so that you will also get the opportunity to discuss.
4 weeks ago, she developed an abnormal involuntary movements involving her left upper limb, lower limb, and lower limb and her face. The movements were sudden in onset, irregular purpose.
Previously. Complaints like.
Slide move. Pinhead. Pinhead.
Okay.
No, slide pinhead.
Okay. It is the
Up and down.
up and down.
Complaining of fever since 4 days, cough and coryza since 1 day, and involuntary movement of left arm, forearm, hand, left leg, foot since 4 weeks.
Okay, so can somebody tell what do you interpret from these complaints? Just from this slide, what is your interpretation? What system you are dealing with? Yes, sir. Stand up. What is your diagnosis?
By looking at involuntary movement of arms and forearms,
We think of CNS. So you normal for yes. Okay. There is fever and cold and correct.
Sometimes comes to your OP with this complaint. There is some involuntary movements for 4 weeks. No fever for 4 days. What do you think? The child had some neurological problem. Now the child has fever and cough and some intermittent illness. Okay. So, what is your idea?
Since this is a history of 4 weeks, it must be a long-standing case. Now the child is presenting with the acute episodes for some other complaints, sir.
Okay. We'll discuss.
Child was apparently asymptomatic 3 months ago. 3 months ago, there was a history of hospital admission with the history of pain in the left hip joint associated with difficulty in walking, for which she was admitted for 4 days and symptomatically treated with analgesics and improved well. 2 months later, 4 weeks ago, she developed.
Is this something past history or is it a present history?
This is past history, but this is significant to the presenting illness, so we have added up in the presenting.
See, this is what we want from you in the exam.
Yes.
So we want some chronology.
Yes, sir.
You understand? So you put this associated to the current history.
Yes, sir.
So there is 4 days of cough cold,
Yes,
then
sir.
4 weeks of involuntary movements, now 3 months of left hip joint pain. So that there is some chronology. Do you understand now? So there is you should take your history like a story. So how better you can put it? If you are going to present, she says this is something very relevant. So this is a rheumatic heart disease. So most of the time in the exam, what happens? Somebody takes you and tell you that this is a rheumatic heart disease. So your mind gets fixated and you present to the examiner in such a way. But the examiner wants, you should act to the examiner that your act is deciphering something. You are not even the mother can say something back and forth. But you should decipher it and bring it in a chronological order. How better we can put it here? How better we can put it here?
Oldest symptoms first, followed by the recent appearances in the order of chronologies.
Yes. So better if the child had some hospital administration 3 months ago. Was there a fever at that time?
No, sir.
So there was no fever, no sore throat.
No sore throat.
So the child hospital administration 3 months back, followed which child developed involuntary movements and now has come to our OP
with complaining of fever.
And cough and cold.
Yes.
So that would be a better.
Yes.
If this is not at all relevant, then you can put it
Past
in
history. Yes.
or history wherever you
Yes.
want. Okay.
Yes.
Continue.
4 weeks ago, she developed abnormal involuntary movements involving her left upper limb and lower limb. The movements were sudden in onset, irregular, purposeless, non-rhythmic, involving left arm, forearm, left leg, hand, and foot, increasing during the stress and activity, and which are decreasing during sleep, which are associated with difficulty in performing daily activities like holding objects, eating, or walking.
So, how better you can put it here? Other, is this a way you present the exam? Is it right or not? Wrong? How many say right? How many say wrong? Right? Wrong? Either you should say you are a boy or a girl. Both you are not lifting your hands. Why you are saying this could be wrong? See, you should tell in parents' words. Okay. Parent says there is some abnormal movements. No parent will say it is involuntary movement, it is purposeless, non-rhythmic, all those things. See, what we want is you should differentiate how you present in CMEs and you should differentiate how you present in exam. You are presenting all these online programs, CMEs and all. You are putting same thing in the exam. The examiner will get irritated. Definitely he will get irritated if you say
was telling the movements were coming off, on and going without her knowledge, and she is not doing it on purpose or voluntarily.
Very good.
And she told while she was taking rest or sleep, the movements are not being
Right,
there.
that is-
Yes.
You
Yes.
you go in that flow.
Sure,
okay?
sure.
So even if you have prepared slides for audience,
Yes.
you present as if you are presenting the exam and tell the mother's word of everything.
Yes.
As per the mother, according to the mother feels
Mm.
okay. Like
Yes.
that you use the words in the exam.
Yeah, sure,
Okay.
sir. Yes, sir. There was no fever. There was no proper diagnosis or at that point of admission, sir. Yes, sir. No, sir. It's migrating polyarthralgia will be there, involving major large joints. So here only monoarthralgia was the presenting complaint. Yes, sir. Yes, sir. So, preceded by sore throat. Fever will be present 3-4 weeks before the onset, sir. And
It is to suggest that this is rheumatic arthritis.
migrating polyarthralgia with fever preceding and AS positive streptococcal.
Here's the history.
No, even the arthritis, we can display the severity of the arthritis in that way.
Much more severe and would require longer treatments also, sir.
What is a rheumatic arthritis typically present? It's arthritis which acid child not be moving at all, right?
Yes,
Joint at all.
yes.
Bones usually a major joint, usually migratory. And the most important point is the traumatic response to your aspirin. That's what is very typical of a rheumatic arthritis.
Within how many days it will respond to aspirin? Within 40 hours it will respond to aspirin. How many days you will give us?
For 3 weeks.
3 weeks. How many days you will give aspirin for arthritis? How many days you will give aspirin for cardiac? So these are all important things.
Yes.
Okay, you continue. You are getting stuck here.
Pranav, I have one small question. Just go back to
Yes.
So you said there was a history of hospital admission.
Yes, ma'am.
Okay, the child was admitted and evaluated for left hip joint.
Yes, ma'am.
So obviously they must have, the doctors there must have thought of something more and done more investigation. All you say is that the child was admitted, given some analgesics, and the child improved. I'm sure the mother will be able to tell you whether they did any further investigations. Some
Documentation.
direction what the doctor told that it would be.
Yes, ma'am. Documentation was unavailable and they were not really well aware of what happened there. But some investigations were definitely done. She was knowing, ma'am. They did not.
Direction.
Yes, ma'am.
Yes.
Yes.
It should be more elaborate.
Yes.
Okay. Continue.
Mother also noticed little clumsiness in her hands and frequent dropping of objects, and there's also little emotional irritability in that 4 weeks. Mother has noticed. Fever is present since 3 days. Labile. She was in on and off liability.
But the emotional irritability is
Labile, yes. Lability.
Then the word irritability.
So now we have a child with 12-year-old girl child, right?
Yes, sir.
With a onset of involuntary movements, which as per is a purpose movements.
Yes.
That's a deterioration of handwriting also, right?
Yes.
So what do you want to think of? What do you want the important rule on?
So it was on the left side at the movements were on the left side, more than handwriting. It was about a schooling. That's what happened in a school.
Since 4 weeks since they started, there was emotional liability and there was peer pressure from her friends, because of which she stopped going to school also. And she was on and off. There were mood irregularities also. Mother was complaining of.
No, I just want to know your child has a purposeless movements. What do you think could be?
It could be either tremors or chorea, which can be ruled out.
Child has a chorea according to you, right?
Yes, sir.
Chorea has chorea, and now child has poor handwriting and poor scholastic performance. What else you want to rule out?
She's coming. Next slide. Come. Continue.
Fevers, their presence since 3 days.
Think of this, like, continue. There is some intercurrent illness, that's all.
No history of loss of consciousness or tongue bite or uprolling of eyes or frothing. No history of focal neurological deficits. No history of head trauma. No history of breathlessness or chest pain or palpitations or syncope and orthopnea present. No history of petechiae, purpura or bleeding manifestations. No history of weight loss or night sweats present. No history of loose stools or dysuria. No history of oral ulcers or photosensitivity rash. No history of morning stiffness or fixed deformities in any large joints. No history of drug intake. No history of family.
These words,
Yes, yes.
Go back to the previous slide. See some of the words
Yes,
which you are
yes.
using with, are all not usually the mother's take.
Yes, I'll make sure.
Photosensitivity, rash. So for the exam point of view,
Yes.
you are doing well.
Mm.
Okay, but we want you to take it from the exam point. You are a third year
Yes.
lab that we used to for exam point of view. Here also fixed deformities, all those. Use mother words when you present these things.
Sure. Past history, relevant histories, history of admission 3 months ago, along with the no similar complaints of involuntary movements previously, no history of seizures, no history of known congenital heart diseases.
See, now you have come up with, you said it was hip, and now you have come up with migratory polyarthritis.
Sorry, sir.
Involving the things for the multiple large size.
So only hip.
So
That's a typo, sir.
this
Only
is,
hip.
this is what we want from you.
Only
Okay.
hip, only large hip.
So how better you could have presented others, anybody, so we should start with some history. Okay, see, chorea is can be intellect, it can present isolated chorea itself, you can take it as a major feature of rheumatic heart disease, and by the time chorea appears, all your ASO, CRP, everything will become normal, so that you may need not have any feature of carditis also, you can diagnose rheumatic heart disease. Okay, so that is absolutely okay. But since you had a very good history, okay, very good history of migratory polyarthritis in the background, so you should start with the complaints of 3 months back, child had some history of migratory polyarthritis associated with or without fever, and definitely if the child has had polyarthritis, the child could have had fever. Without the fever, you should say it as polyarthralgia. Okay, or you should say it as arthralgia. What is the criteria? New criteria, 2015 updated criteria.
In major criteria, polyarthritis or monoarthritis according to the risk population it's present.
Very good. So that is a major change as per your 2015 criteria. We are in which population?
High risk population.
We are in high risk population. How do you define high risk population?
2 lakh people, 2 per 1 lakh
1 lakh.
population will be present.
How per 1 lakh?
Only less is significant, sir. Anything not less is high risk, sir.
So 1 lakh for each age.
5 to 15 years of age group, sir. 15 years, which is the most dominant age group for rheumatic fever.
Or 1 per 1,000 has rheumatic heart disease. What is the incidence of rheumatic heart disease? See, the incidence
6 per 1,000.
incidence was 1%. Now it has come down to 0.5%. Why? Because of good. We are now moving the nuclear family. Now we are having good socioeconomic status. People are now having they can afford for treatment. What are all the risks? Rheumatic heart disease.
Population, high risk population, so where more
Risk factor.
socio-economic status will be the one, over poverty and overcrowding. History of any other sibling with similar complaints.
Okay. Who is more affected, boys or girls?
As of one recent study, both are similar. There is similar risk of male and female. But female has little predominance over male in the previous risks criteria, sir. Girls.
Boys or
Girls has.
The major criteria, some manifestations towards each gender,
Overall rheumatic heart disease wise, there is a population risk criteria which is in the females has much more predominance, but in the recent guidelines it has similar population they are mentioned. stop.
So there is a major compatibility complex.
Yes.
All these are.
Yes.
So with your history like this, you should start with your migratory polyarthritis. Then definitely there would have been fever. Then you should have come with your neurological problems. Then because if you do now any investigation will be positive.
No.
What are the investigations you do?
ASO titers, all the CBC values, then throat swabs we can do. Streptokinase enzymes, ASO, CRP, yes sir.
ESR. Other supporting evidence?
ECG, echo,
Other
PR,
antigen test?
yes, throat swab,
Okay.
streptokinase.
So will all be positive here?
No.
If at all it is positive, what thing will be positive?
It's a little bit lingering or prolonged of all these parameters.
Anybody?
ESR can be slightly.
Will your rapid antigen be positive here?
No.
Will your culture be positive?
No.
Your throat swab culture be positive? Is throat swab culture specific? Why it is not specific? Because
Strains.
a lot of people cannot place of previous carriage.
Strains are also.
So throat swab is not very specific. So which will be ASO will be positive. ASO is very, very sensitive if it is acute. You can do anti-DSDN. Okay. Then if it is associated with your chorea, you can do anti-neuronal antibodies. There are anti-neuronal antibodies which can be positive.
Yes.
Continue.
Antenatal history.
If all our students may please go back to your list. See, this fast institution in the history of admission 3 months back is not fast. All along, sir has been telling you that
Yes.
it is a part of the present illness. All our students do that. Any illness which has been associated or which is significantly related to this, it is a part of the present illness. It doesn't go into the past.
Yes.
So if your complaint itself, the exact the word, 2 words you mentioned in the complaint should tell your diagnosis.
Yes.
That's for the audience. Continue.
Antenatal history. Pregnancy was confirmed by a urine pregnancy. Nothing, sir. Antenatal history is uneventful.
Next.
Full-term normal emergency LSCS. Girl. Nutrition.
You know, it must be an acquired condition. In contextually, we can tailor-make it to that.
Yes,
So regarding the birth development, you can tailor-make.
Yes. No developmental delay noted. Immunized till 5 years of age. There's no family history relevant to similar complaints or history.
Okay, so we'll stop. So with this, can somebody answer? With this, you think it is acquired or congenital? Your approach should be like this. In cardiac is given to, is it acquired or congenital? You say it is acquired. Why do you say it is acquired? Very good. First point is 8 of 4 website. Any congenital heart that can present date? This is what we are going to ask you the exam. I didn't say it is acquired heart. Now she will summarize. She will say acquired heart. Why do you say it is acquired heart? Okay. So there are several points that she missed in communicating that it is not congenital. Very good. So that should be failure to try again. Okay. Recurrent respiratory tract infection should be present in the history. So that these are the points that she should emphasize in the history. Then the both can have acquired also can present with failure. What are the other acquired heart diseases? Acquired heart.
Infective endocarditis.
Infective endocarditis. Common thing. Myocarditis.
Viral myocarditis.
Okay, these are all common things that is there. So what are other points? You want to say that it is not subjective. So you she should mention that mother did not see any abnormal faces or any abnormal problems with the and the food. So to tell that it is not syndrome, you should consider it problems are associated with syndrome, considering heart. Okay.
Yes, sir. Yes, sir. Sir, still at this level, we are the only involuntary movements history level. We are not sure that whether the heart is involved in this girl.
That is what I'm telling. So if she started with involuntary movements at the present CNS case, then it should be something related to the CNS. Since you have presented it as a rheumatic heart disease with the history of polyarthralgia, then you should bring that up and then you present all these.
So that you the polyarthralia is not the only left. He was for 2 days. She was
Maybe it is difficult even for your consultant. But I'm telling you, if that case comes in the exam, you should present in such a way that you do know that you not know the case previously.
Yes.
Just for learning. Okay. This is not for something to underestimate. It's just for learning. If case comes in the exam, you should show to the examiner that it is an acquired heart with all these points. Okay.
She was born out of a non-consanguineous marriage, and she belongs to a lower middle class family along according to modified Kuppuswamy scale. Summary: she's a 10-year-old, she's 12-year-old female child, first born out of non-consanguineous marriage. Younger siblings.
Anything else you want to tell in the family and the social status?
She belonged to a lower middle class family according to modified Kuppuswamy scale. Pakka house, no overcrowding is present in
So, see, from the PG point of view, what you should do is who is taking care of the child daily? Okay, whether the mother or father, who is working in the family. So who is bringing the child to the hospital frequently? If the child is CT like the last case. So these social points and all, the examiner wants these social points. So whether they can continue bringing the child to the hospital or not. Okay, there are several points. These are all the points that we see daily. So from the undergraduate level, the examiner will want all these. From a postgraduate level, the examiner will want to know whether they can sustain this treatment, where they are taking treatment, whether in the government hospital or the private consultant. How much is the cost? Their total per capita income is only 10,000 per month. So with this, how they are affording this child? Okay, this child would have been started on the pencil.
Yes.
So whether they are taking in the hospital, which hospital? So all these points we should take. Okay. Anything else?
Nothing. Summary.
Anything else?
No, example.
Summary.
Was born out of a non-consanguineous marriage, belonged to lower middle class family, presenting with involuntary movements involving left upper arm, lower and lower limbs. Since 4 weeks, associated with clumsiness and dropping of objects, and history of migratory polyarthritis involving 2 large joints for 3 months, associated with swelling is present. History of hospital admission 3 months ago. This case is a probable suggestive probably of acute rheumatic fever with sudden ham scoria or migrating polyarthritis.
So anything else?